Zoloft is a medication commonly prescribed to treat various mental health conditions. It contains the active ingredient sertraline, which helps regulate serotonin levels in the brain. Serotonin is a neurotransmitter that plays a crucial role in mood and emotions. By targeting serotonin, Zoloft can provide relief from depression, anxiety disorders, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. Common uses of Zoloft. Zoloft is primarily used to treat depression. Depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and a lack of energy. Zoloft works by increasing serotonin levels in the brain, which can help alleviate these symptoms and improve overall mood. In addition to depression, Zoloft is also prescribed for various anxiety disorders. Anxiety disorders encompass a range of conditions, including generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. Zoloft can help manage feelings of worry, panic, and social anxiety, allowing individuals to regain control and improve their quality of life. Another common use of Zoloft is in the treatment of obsessive-compulsive disorder, OCD. OCD is a chronic condition characterized by intrusive thoughts and repetitive behaviors. Zoloft can help reduce the frequency and intensity of these symptoms, allowing individuals with OCD to better manage their condition and experience relief. Lastly, Zoloft is prescribed for individuals with post-traumatic stress disorder, PTSD. PTSD is a condition that can develop after experiencing or witnessing a traumatic event. Zoloft can help mitigate intrusive thoughts, nightmares, and other distressing symptoms associated with PTSD, enabling individuals to better cope and regain a sense of stability. Benefits of using Zoloft. One of the significant advantages of using Zoloft is its effectiveness in reducing depressive symptoms. Many patients report a significant improvement in their overall mood, with reduced feelings of sadness, hopelessness, and lack of energy. Through its action on serotonin levels, Zoloft can help individuals regain a sense of joy and motivation, allowing them to engage more fully in their day-to-day activities. Zoloft also offers relief from symptoms associated with anxiety disorders. Individuals taking Zoloft often experience a reduction in feelings of worry, panic, and social anxiety. This can lead to improved social interactions, reduced stress levels, and an overall improvement in quality of life. For those with OCD, Zoloft can be life-changing. By targeting the underlying neurotransmitters involved in OCD, Zoloft can help reduce the frequency and intensity of intrusive thoughts and repetitive behaviors. This allows individuals to regain control over their thoughts and actions, leading to a significant improvement in their daily functioning. Similarly, Zoloft can provide relief for individuals with PTSD. By reducing the intensity of intrusive thoughts and nightmares, Zoloft can help individuals manage their symptoms more effectively and improve their overall well-being. This can lead to a better quality of life and increased ability to cope with the effects of trauma. It is important to note that the benefits of Zoloft may vary from person to person. It may take several weeks for the full effects of the medication to be felt, and a healthcare professional should closely monitor the individual's progress to ensure the optimal dosage is being prescribed. Potential side effects of Zoloft. While Zoloft is generally well tolerated, it is essential to be aware of potential side effects that may occur. Common side effects of Zoloft can include nausea, diarrhea, insomnia, and sexual dysfunction. These side effects are usually mild and tend to resolve on their own as the body adjusts to the medication. However, if these side effects persist or become bothersome, it is important to discuss them with a healthcare professional. In rare cases, Zoloft can cause more severe side effects. These may include serotonin syndrome, which is characterized by symptoms such as agitation, hallucinations, rapid heartbeat, and fever. Serotonin syndrome is a potentially life-threatening condition and requires immediate medical attention. It is crucial to report any unusual or severe symptoms to a healthcare professional promptly. Zoloft may also increase the risk of suicidal thoughts or behavior, particularly in children, adolescents, and young adults. It is essential to closely monitor individuals taking Zoloft for any changes in mood or behavior, especially during the early stages of treatment. Open communication with healthcare providers is crucial to ensure the appropriate support is provided. Dosage recommendations for Zoloft. The dosage of Zoloft recommended will depend on the individual's specific condition and medical history. In general, Zoloft is started at a low dose and gradually increased over time to find the most effective dosage. This approach allows the body to adjust to the medication and minimizes the risk of side effects. It is important to follow the prescribed dosage and never adjust the dosage without consulting a healthcare professional. Abruptly stopping Zoloft can lead to withdrawal symptoms, including dizziness, headache, and irritability. If there is a need to discontinue Zoloft, a healthcare professional will provide guidance on how to safely taper off the medication. Regular follow-up appointments with a healthcare professional are necessary to monitor the individual's response to Zoloft. Adjustments to the dosage may be made based on the individual's progress and any side effects experienced. Risks and precautions associated with Zoloft. While Zoloft can bring substantial benefits, it is essential to be aware of potential risks and precautions associated with its use. As mentioned earlier, Zoloft may increase the risk of suicidal thoughts or behavior, particularly in young individuals. Close monitoring, especially during the early stages of treatment, is crucial to ensure the individual's safety. Zoloft should be used with caution in individuals with a history of seizures, as it may lower the seizure threshold. It is important to discuss any history of seizures with a healthcare professional before starting Zoloft. Additionally, Zoloft may interact with certain medications or substances, including monoamine oxidase inhibitors, MAOIs, blood thinners, and alcohol. It is important to inform a healthcare professional about any other medications or substances being used to prevent potential interactions. Zoloft should not be taken during pregnancy unless the potential benefits outweigh the potential risks. It is important to discuss the risks and benefits with a healthcare professional when considering Zoloft during pregnancy. Alternative treatments to Zoloft. While Zoloft is an effective medication for many individuals, it is not the only treatment option available. Alternative treatments for depression, anxiety disorders, OCD, and PTSD include various forms of therapy, lifestyle changes, and other medications. It is important to consult with a healthcare professional to explore all available treatment options and determine the best course of action for the individual's specific needs. Therapy options may include cognitive behavioral therapy, CBT, which focuses on changing negative thought patterns and behaviors. Other forms of therapy, such as interpersonal therapy, IPT, and psychodynamic therapy, may also be beneficial depending on the individual's needs. Lifestyle changes, such as regular exercise, a healthy diet, and adequate sleep, can also have a significant impact on mental health. Additionally, incorporating stress management techniques, such as mindfulness or relaxation exercises, can help reduce symptoms of anxiety and stress. In some cases, other medications may be prescribed as an alternative to or in combination with Zoloft. Each individual's treatment plan should be tailored to their specific needs and may involve a combination of therapies and medications. Consultation and prescription for Zoloft. Zoloft is a prescription medication, meaning it can only be obtained with a prescription from a healthcare professional. If an individual believes they may benefit from Zoloft, it is essential to schedule an appointment with a healthcare provider. During the consultation, the healthcare professional will assess the individual's symptoms, medical history, and overall health to determine if Zoloft is an appropriate treatment option. Once the decision to prescribe Zoloft is made, the healthcare professional will provide the individual with a prescription and instructions on how to take the medication. It is crucial to follow these instructions carefully and to reach out to the healthcare provider with any questions or concerns. Managing Zoloft side effects. If an individual experiences side effects while taking Zoloft, there are several strategies that can help manage them. Nausea can often be alleviated by taking Zoloft with food or adjusting the timing of the dose. If insomnia occurs, practicing good sleep hygiene and discussing the issue with a healthcare professional may be beneficial. Sexual dysfunction, such as decreased libido or difficulty achieving orgasm, can be a side effect of Zoloft. Open communication with a healthcare professional is essential to address this issue and explore potential solutions, such as adjusting the dosage or trying a different medication. If side effects become severe or bothersome, it is important to reach out to a healthcare professional for guidance. They may recommend adjusting the dosage, switching to a different medication, or exploring alternative treatment options. Conclusion and final thoughts. Zoloft is a widely prescribed medication that offers relief from various mental health conditions, including depression, anxiety disorders, OCD, and PTSD. By targeting serotonin levels in the brain, Zoloft can provide significant benefits, such as reducing depressive symptoms, managing anxiety, and alleviating the distressing symptoms of OCD and PTSD. While Zoloft is generally well tolerated, it is important to be aware of potential side effects and risks associated with its use. Regular monitoring and open communication with healthcare providers are crucial to ensure the individual's safety and well-being. Zoloft is just one treatment option among many, and alternative treatments, including therapy and lifestyle changes, may also be effective for managing mental health conditions. Consulting with a healthcare professional is essential to explore all available options and determine the best course of treatment for each individual. Overall, understanding the applications, advantages, potential side effects, dosage recommendations, and risks of Zoloft is essential for those considering or currently using this medication. By working closely with healthcare professionals and being actively involved in the treatment process, individuals can find the support they need to improve their mental health and well-being.